Pediatrics, normal child development. There are 4 main fields of development. These include gross motor, which is movements of arms and legs and head, sitting, standing, and walking. And then there's vision and fine motor is categorized together because in order to have fine motor skills, you need to have good vision. And then next is hearing, speech, and language. Same as before. In order to have a good speech and language development, you require hearing, so that's categorized together as well. And then lastly, you have social, emotional, and behavioral development. So what is development milestones? Development milestones is the age of acquisition of important developmental skills. There are 2 terms that we need to know here. There's the median age and the limit age. Median age is the age at which half of the standard population has achieved the level of competency, the level of development. It serves as a guide. And then the limit age is the age at which 97.5% of the standard population has achieved the level of competency. That's calculated by 2 standard deviations above the mean. If a child has not reached the level of competency by the limit age, further assessment is recommended. Although not all children who has not reached the level of competency by the age has developmental problems, but some of them might have problems that we have to look into. For example, if you have problems with speech, you might have problems with hearing. If you have problems with fine motor, you might have problems with vision. When you're doing pediatrics, it's good to remember a few limit ages off the top of your head because then you'll know when development is not normal and when you should further assess their development. So for gross motor, head control should be achieved by 4 months. These are all limit ages, so by this time 97.5% has already achieved these skills. Before acquiring head control, if you lift the baby up from the bed, the head will just fall to the back. That's called head lag. And head control is when the neck muscles prevent the head from falling back. That's when you have achieved head control. And sits unsupported by 9 months, stands with support at 12 months, and walks independently although unstably at 18 months. These are the limit ages. Next, we go to vision and fine motor skills. By 3 months, the baby should be able to fix and follow things visually. By 6 months, they should be reaching for objects. By 9 months, they should be able to transfer an object from one hand to another. And by 12 months, they should have a pincer grip. Pincer grip is holding things between your thumb and index finger. Next is hearing, speech, and language. The limit ages are 7 months for polysyllabic babble. These are things like dada, mama, baba. By 10 months, there should be some consonant babbles, things like saying 6 words with meaning by 18 months, join words by 2 years, and 3-word sentences by 2.5 years. Next is social behavior. By 8 weeks, the baby should be smiling. By 10 months, the baby should have a fear of strangers. By 18 months, the baby should be able to feed themselves with a spoon. By 2 to 2.5 years, they should be having some symbolic play. So the toys have some sort of character. by 3 to 3.5 years, they should be able to do some interactive play, means playing with other children. At different ages, there will be rapid expansion in different skill areas. This is useful when you want to do a rapid assessment of development. For gross motor, the rapid expansion starts before 1 year. Vision and fine motor is 1 year and above. Hearing, speech and language develops rapidly 1.5 years and above, and social, emotional and behavioral development develops at around 2.5 years rapidly. So if a child is around 1 year old, it will be smart to assess their gross motor development first. And if a child is 3 years old, it might be more efficient to ask about social, emotional and behavioral development first. Next, we'll be talking about the variation in the pattern of development. Not all babies develop in the same pattern. For example, in walking, there are variations from crawling to bottom shuffling to commando crawling, and then only they develop walking. 83% of babies crawl first and then walk. In these cases, the median age for them to start walking is 12 months and the limit age is 18 months. In other cases, babies who bottom shuffle and then walk, their median age for walking is 18 months, which is later, and their limit age for walking is 27 months. The slowest to walk is those babies who start by commando crawling. They are crawling on their tummies. And some babies, although very rare, they stand up and walk straight away. Next, we'll talk about adjusting for prematurity. There are two terms to learn here: chronological age and corrected age. Chronological age is the age starting from the date of birth of the baby, and corrected age is the age starting from the expected date of delivery of the baby, which is calculated by using the last menstrual period before the mother gets pregnant plus 40 weeks, or you can calculate it through ultrasound scans during pregnancy. The corrected age should be used in assessing development in preterm babies up to 2 years old. For example, an 8 weeks old baby who is born 2 weeks preterm should be assessed based on the development milestones of age 6 weeks. After 2 years old, the few weeks of prematurity is becomes a small fraction of their lives, so this can be neglected.